Hi, I'm Dr. Bryan Fitz, North Edmonton Chiropractic Clinic in Edmonton, Alberta, Canada. I've put a PowerPoint presentation together and we're just going to show you some of the things that I think are important to understand about chiropractic. Chiropractic manipulation, the key to unlocking your spinal health. 10 most dangerous thoughts you can ever buy into about your health. Maybe it'll go away, it comes and it goes, my doctor couldn't find anything wrong, it's not that bad, it only hurts when I know what my problem is, and they think it's arthritis. That's one example. I was told I've got to live with it, so I do. I've been this way for years, why change now? I don't want to know, and it's because of my age. If you buy into one of these lies and you have something growing in you like cancer, and you think, oh, it's not that bad, it only hurts when I do this, by the time you deal with it, it's going to be more serious. And some people that have departed from us bought into those lies. By the time people come to my office, they're loaded with arthritis. They come when they're 50 or 60, but they had their car accident or their fall when they were 20 or 30, and they bought into this thing, well, it's not that bad, it only hurts when I do this, and my doctor couldn't find anything wrong. And so finally, when the pain threshold is so high, they come to the chiropractor, we take some x-rays, and we're dealing with some mechanical dysfunction with layers of calcium that's built up, and there's some degeneration already. This picture of a guy who's getting his mug shot taken, and he's wondering, well, how did I get in this mess? Occasionally there's accidents that happen to us time to time. They're not our fault, but the vast number of health issues arising in our life are due to neglect and lack of personal responsibility. Everybody can do the change, after they have the heart attack, after they have the diabetic diagnosis, after they've, been told they have, cancer from smoking. Okay, then they can stop, but before then, they don't take personal responsibility. And this is what this health talk is about, taking responsibility for your health. So when they have the problem and they crash and they go finally to their doctor, what is he going to give them? He's going to give them drugs. And drugs only mask the problem. They don't fix the problem, they only mask it. Brace yourself for a new understanding of your responsibility to take care of your health. You are responsible for your health. I threw this slide in because most people don't know that to become a chiropractor, it takes just as many studying hours, 7 years of education, just like your medical doctor. I put the hours of medical training on the left and the chiropractors on the right. They're both about 2,800 hours. But what's interesting is that to become a chiropractor, chiropractors have 3 times more neurology than the MDs. Neuroscience, neurology is 3 times the education, and we have double the x-ray information. So we were taught to train to take x-rays as well as read them. And orthopedics, which is to do with your bones and the body, range of motion, what's symptomatology to do with the backs and necks, which is what we treat. We have 225 hours where the MDs only have 156. Your brain is connected to your body, and this is a brain with a bunch of cables coming to it. But the main point is it is your harness system, your wiring system coming off the brain that goes between, down the spinal cord and sends off little nerve roots between each bone called the foramina to your heart, your liver, your stomach, your kidneys, and all the organs of your body. Now I always like telling people, if you pinch the nerve right here, do you think it's going to affect the signal getting to your heart or vice versa? And they all say, yeah, probably. And so the example I give is when you have a heart attack, where do you feel the pain? And you go to any textbook, it says heart attack, you can have pain in your left shoulder, you can have it right shoulder, you can have it in your neck. I was telling one patient and he says, yeah, it happened, I felt it in my jaw. So how does the pain get from your heart when you're having a heart attack to your jaw? And it's through the nervous system. The nervous system is two-way street. It's sending signals up to your brain and it's sending signals down. And if you have an irritation or a pinched nerve or a nerve that's not getting full signal, you're going to have dis-ease in the system. And chiropractic is affecting the spine where the whole spinal cord and the nervous system is connected to. Chiropractors are known for manipulating, but the correction that we're doing is we're working on a subluxation. And a subluxation is defined by 3 things here. It's either a bone that's partially or incompletely dislocated. So I use my hands as a bone, and if one bone is slipped over the other, that's a subluxation. or it's a restriction in motion. You're trying to turn your neck to the left and it stops. You can turn freely to the right. Or it's an aberrant relationship between two adjacent articular structures. And the example I use is if your shoulder is a ball and socket, and this is your arm sticking in the socket, and the muscle's too tight on the front. It's pulling the socket to the front and the muscle's pulling that ball and socket to the front. It's rubbing wrong. You have an aberrant relationship, and that's a subluxation. So the hypothesis is that these are reversible joint lesions, and a chiropractor manipulation will restore the function at the subluxation. And some of the conditions that chiropractors treat I listed here because I found over the years that if I don't tell people, they don't know. And they know maybe that we adjust their necks or help their backs, and then 3 or 4 years later they say, oh, you treat shoulders too? Oh, you treat elbows? And the reason they didn't know is because I never told them. So I put a slide in so that people can have a better understanding of some of the conditions. Chiropractors treat headaches from neck tension. A lot of headaches are neck tension headaches, and there's a great success with chiropractic in relieving headaches. Sprains and strains of any sort, injuries, muscle, whiplash injuries, car accidents. Anybody who's been in a car accident should see a chiropractor for a trial of chiropractic. Muscle pain syndromes, shoulders, knees, ankles, wrists, joints. Anywhere where there's a joint, a spinal joint, chiropractors will adjust those joints. Minor and moderate disc herniations. If you've herniated your disc, it doesn't mean you can't have chiropractic. In fact, the literature that I've read says a person should at least have a trial of chiropractic before they do any surgery, unless they have lost control of bowel and bladder. Early and moderate arthritis. A lot of my patients have arthritis. A lot of doctors don't realize, oh, you can adjust with arthritis. Arthritis is actually a common condition that people should seek chiropractic care. It restores function because there's calcium being built up around the rims of the joints. And sciatica, which is leg pain, and chronic pain. We treat pregnant ladies all through their pregnancy because of the postural changes, and you can see because of the weight up front that it's affecting their back and their muscles, that they need manipulation. Here's a lady that has scoliosis, and you can see there's a rod in her back that's fusing her spine to keep it from going any further in its scoliosis. Chiropractic can't stop or reverse someone that's in this state. If she was maybe younger, in her teens, chiropractic adjustments may have slowed that down and stopped that. I treat several girls, young girls right now. They're coming on a regular basis. They have scoliosis, documented scoliosis, and chiropractic will take the tension out of the sides of the back where the spine is not moving because it's compressing and because the muscles are too tight. Children, they should see a chiropractor. They jump, they fall, they swing. They have the spine just like any adult. They should see a chiropractor to make sure that all things are lined up and working properly. A subluxation is a bone that's out of alignment. This is a true documented subluxation. You can see this is the lumbar spine. There's a tailbone right here. This bone is shifted, number L5, right over the tailbone by about 1 inch. This is called spondylolisthesis, and it is a true subluxation where the bone is shifted over the other. This is the normal lumbar spine facing the other direction. You can see a normal curve. You see every bone has a nice square, clean square box, and there's a space between each bone which is nice, about I'd say 1/4 to 1/2 inch space, and that's called the disc space. And when it gets damaged, it goes flat. And this is an example of a degenerative disc where the fluid is no longer in the disc and it's gone flat, and that is what arthritis looks like in a back that's got degenerative disc disease. But the closer you get bone to bone, the more likely or predisposed that bone is to locking and jamming and not being able to turn, because the disc space is gone, the bones are compressed now, and there's a more likely predisposition to a subluxation at that level. Chiropractor treatment will restore the function at arthritis levels like that. Here's a cervical spine. You can see that there's a normal curve with, if you draw a line under each spinal vertebra, Those lines taper to a radial spot as if you were drawing a giant circle, and the radius is there. This is about 12 inches behind the neck, and you can see that they all come together, and that's a normal curve. Remember that the curve that's normal is at the back of the spine, because we're going to show you later on some reverse curve. And this is degeneration of the neck, where the bones are bone on bone. There's no disc space there, there's no disc space there, there's a little bit of disc here. And then you can see in the front there's some chicken beaking, or like a chicken beak, where calcium's build up around the front. If you go back to the other, you can see that the bones are nice and square. They're nice and smooth on the front. You go to arthritis and you get calcification on the front of each bone. Here's a lady, 30 years old, with reverse curve. You draw the lines on the spine and all the curve goes to the front, and she's tilting her head forward and she doesn't even know it. And she's coming to me, she's got headaches, she's wondering what's wrong. She's 30 years old. And so the sign that you have a problem might not be pain, it might be just your curve is wrong and you don't know it till you take an x-ray. Here's another lady who has no curve at all. You can see that it's straight like a stick. So you can have normal curve, you can have reverse curve, and you can have no curve. And most people don't know what kind of curve they have. And sometimes the radiologist who gives us a report doesn't even comment about curve, because the medical community doesn't even care about curve or alignment. They just want to know, is there cancer, is there arthritis, is there something that's really a bony problem that we can, you know, notice blatantly. But curve isn't usually one of their things they're concerned with. Here's blocked vertebra, two bones that are fused since birth. You don't know what your bones are like till you've had an x-ray. Back to the normal lumbar spine. This is the one I showed you before. Nice curve, every bone is nice and square. You can see there's a space between each bone, and here's the tailbone. The reason I like showing this is because the next one is the worst x-ray I have on file. What does medicine offer you after the drugs wear out? You get drugs, you get stronger drugs, you get more drugs, and then you get surgery. And people say, well, I need surgery, I want surgery, I need surgery. Well, I'll tell you, you don't want surgery unless you absolutely have to, because this is steel bolts drilled into the person's spine, which are fusing the spine together, because every time they moved, they're in screaming pain. And here's some more surgery. This is hip replacement, and you want to avoid this at all cost. Now, I'm saying sometimes you need it. If you break your bone, there may not be another option, but you should do everything possible to avoid that, and chiropractic will help restore function and delay and slow down degeneration. This is a young lady, 18 years old, came in with back pain, and her spine was on x-ray, was tilted all to the one side. And it's short about an inch at the ball and socket by the hip and at the crest of her pelvis. Whenever I see this on one side of an x-ray, I kind of lean towards a diagnosis of leg length inequality, meaning her leg is short in the bone. We did a special x-ray of her legs, and the radiologist with a tape measure said, yeah, she's 2.5 centimeters short. But once every month I find a patient coming in, a new patient whose legs are short, they didn't know it. And sometimes they already have arthritis in their hip and their back. This lady's only 18. We fixed it by putting adjustments of her spine and putting an orthotic with a lift in. So orthotics are special devices, like custom-made orthotics. We do a measurement of your foot, and we put a lift that matches the discrepancy of the leg length, and we bring the person back to level, and we save them lots of problems. So the point here is that you have a spine in your body, and inside that spine is your nervous system. Your brain is sending through the spinal cord the whole wiring system to your whole system. Your internal organs, your muscles, your ligaments, gives you heat, cold, pressure, temperature, range of motion, all your ability to function. And you only get one spine per lifetime. We recommend that after you go to chiropractic and you get your adjustments and you get your symptom relief, your symptoms removed, your pain gone, your intensity of pain, your flexibility, the range of motion that you lost back, that you do some, or consider at least, maintenance. Maintenance is keeping a body in the state of good repair. We keep high-tech equipment in good repair. We do maintenance on our house, do maintenance on our car. Maintenance is upkeeping a body or a machine in good repair. And You only get one spine. I tell the ladies that if your spine was on your face, you'd take better care of it. They spend $30 on their nails and $30 on their creams and 50 to 80 on their hair, and they're not even movie stars. You only get one spine per lifetime, and you can get new teeth, new dentures, but if your spine wears out, the only option they have is steel. There's no denture spines around. It will spend 5 to 10 grand to have, the perfect smile. And we'll even let the dentist adjust those teeth once a month for 2 years. And we'll go 2 years to get those teeth right. But how long will you allow a chiropractor to correct your spine after you come in at 50, 60 years old and you're full of arthritis and you can't bend or twist? How many chances do I get to fix your bones and do an adjustment on them to correct that problem? And then once you're better, to do maintenance to keep it. Confucius says, he that doesn't take time to stay well will have to take time to stay sick. I see that lots of times. People have not done their maintenance. They haven't taken care of their body. They haven't eaten right. They haven't exercised. And they come with mechanical symptoms, mechanical dysfunction, and screaming pain from nerves that are irritated or inflamed, and they need therapy. And I recommend at least a 10 treatment trial of chiropractic, and judge for yourself. Have a great day.